My presentation topic, effect of local application of Shweta Aparajita Mula and Chitrakamula along with Eve's Mill on vitiligo, that is Shweta and children, is mainly guided by Dr. Shailaja, Professor and HOD, and also Dr. Pramod Ingre, who is Assistant Professor in SGR Ayurveda College, Maharashtra. Coming to introduction, the study basically included treated and placebo group with children age group 5 to 15 years based on randomized sampling carried out with certain Ayurvedic drugs and given Virechana once in both the groups to test the efficacy in Shweta, that is vitiligo. Duration of the treatment was given for 2 months with follow-up study of 3 months. During this time, grading were given, various gradings were given, and photography were the main criteria. Purpose: the Ayurvedic Samhitas mentioned about need of Shodhana in Shweta and describe use of many lepas for Shweta. Hence, there is necessity to explore the indigenous source for the treatment. To evaluate the effect of external application of Chitraka root and Shweta Aparajita root and Eve's Mill, that is Avika, on vitiligo patches after giving Virechana once in treated group. To observe the effect of only Virechana in Shweta once and followed by local placebo applications. Methods: the source of data was children attending OPD of SDM Hospital, Hassan, with complaint of Shweta formed the materials for the study. Inclusion criteria were the age group of 5 to 15 years and patients who were diagnosed as Shweta as per the features mentioned in Samhita. And exclusion criteria were white anesthetic spots which are characteristic of leprosy, and patients below 5 years of age and above 15 years of age were excluded. Patches of 1 year, more than 1 year old, and patches arising on the fingertips, nail beds and in genitalia are excluded from the study. Vitiligo patches complicated by other diseases like eczema were also excluded, and sample size was 28, that each group consisted of 14 children with 4 dropouts, 13 treated and 11 children were left in treated and placebo group respectively. And Deepana Pachana was done for 2 days. Snehemana done with Murchita Vagruta till the Koshta Sindha Lakshanas were observed, then followed by Abhyanga with Murchit Thiratena for 3 days and Sarvanga Sweda. Then 20 grams of Arapada Kalamajja was administered with warm water after Abhyanga and Sweda on 3rd day, and type of Koshta Shuddhi was observed. Patient of group A were advised to apply the placebo daily in the morning on the vitiligo white patches with Eve's Mill, and similarly the patients of group B were also advised to apply the paste of trial drug and were advised to expose to the sunlight for 15 minutes. The treated group consisted of Shweta Aparajita root and Chitraka root with Eve's Mill, and placebo group were given aerial root like water. The criteria for assessment included alternation in the color of vitiligo patches or any black dots appearing in the white patches were recorded periodically with photography. Number of dots was counted and joining of 2 or more dots, that is black dots, if any, was noted and recorded. Change in the size of observed patch, if any, was also recorded. The study period for 2 months and follow-up for 3 months was done. Then the results: the effect of trial drug was proved highly significant result in changing the color of white spot at p-value of less than 0.01 at the end of first month of treatment. However, it gives insignificant result on clinical trial, that is for number of black spots and size of observed spot. The effect of trial drug provided a highly significant result in changing the color and in increasing the number of black spots with p-value of 0.001 at the end of second month. However, only 19% reduction is seen in the size of the patches. The effect of trial drug provided highly significant result in changing the color and in increasing the number of black spots with p-values at the level of 0.001 after 5th month. However, only 27% reduction is seen in the size of patches. The effect of placebo drug shows insignificant result in changing the color. It shows no alteration in reducing the size of observed spot and in increasing the number of black spots during the first month of treatment. The results were observed in reducing the size of observed spot and increasing the number of black spots during second month. There is also increase in signs observed in this placebo group. The effect of placebo drug provides insignificant result in changing the color, in reducing the size of observed spot and increasing number of black spots each during 5th month of treatment. This is in the trial drug before and after treatment. One of the patients have just taken. So conclusion, early improvement is seen if viscota, that is blood, is developed on application of LEPA. Patches having white hairs responded late to the treatment. Local treatment is found to be more effective after Shodhana Chikitsa in present study. But it is possible that local application even without Shodhana may help in treating the Shvitra. However, this also needs further study. And the same drug compound, if continued for longer time, may give better results. Thank you.
Charak Samhita names 3 types of Svitra. Vataja Svitra is easy to cure. Pittaja Svitra is harder to cure. And Kaphaja Svitra is said to be very difficult. Why didn't you determine or state the kinds of Svitra, Vataja, Pittaja or Kaphaja, which you were analyzing?
No, so basically we just took based on Sadhya Lakshanas. We didn't get like the patients as per the classical like Vata Pittaja. So we found better to take it like what I have done in inclusion or exclusion criteria, that more than 1 year or having affected nail beds or genital area which is asadhya.
In the Institute of Applied Dermatology in Kasaragod, they found Vataja, Pitta, Svitra very easy to cure completely. The Pittaja Svitra develops the black spots in the middle, but they don't get very connected. And the Kaphaja Svitra, they have no effect on at all. Did you notice similar differences between your patients?
So basically,
you said you saw 20, you said at one stage, 27% reduction in the size of the black patches, okay, in the size of the white patches. Now that could mean that 27% of the patients were cured completely and everyone else had no effect at all. So it doesn't tell us what your best result was or what your worst result was. When you quote means like that, it's very important to give the range. Did you have 1 or 2 patients in the Ayurveda group with no improvement at all? What was the highest reduction that you saw?
it was in the only size of.
Yes. What was the best reduction you saw in the size of the white patches?
Sir, I didn't get best.
Can you explain?
Yeah. See, what he wants to know is, after 3rd month, you said 27% reduction in the black spots.
In the white spots?
In the white spots and appearance of certain black spots. So he wants to know, was it amongst which kind of Prakriti people?
What was the best result?
What was the best result? Amongst the treatment that you are given, which dosha people got the best result?
Is it Vataja Shvitra is best, Pittaja Shvitra is best, or Kaphaja Shvitra?
She has answered it. She said she didn't do Prakriti.
No, sir, I didn't know.
Yes. No. You have to analyze which type of Shvitra. Then only it becomes Ayurveda analysis. Otherwise, it becomes Herbopathy.
I still want to know. Did you? No, I still. Did you have any patient who was completely cured? One white patch was completely removed. Did you see any patient who you completely removed one of the white patches?
So the patch which was treated have reduced like to maximum, but then it did not get cured completely. The patches again appeared and.
Did you see the, you get a gradation of color. When we saw that picture that you just had on the screen, it wasn't a reduction in the size of the patch down the face, but it was an improvement in color. So, were you talking about, in your 27%, improvements in color quality or actual size area of the patch reduction? When you do more experiments, if you do more experiments, you must distinguish between the colour and the area. You understand? Yes.
Have you seen any recurrence? How much did they follow?
She did only 5 months study.
Only 5 months.
She won't know.
For how
Yes,
many
sir,
days?
still some of the patients are coming. So they have like that place. It has reduced to maximum extent, but again it has occurred like the patch has occurred in some other area. So it is. I don't claim it has.
You have treated only for 3 months or extra?
5 months.
5 months.
Only 5 months. Okay.